Hello and welcome. Let's talk about supracondylar fracture of humerus. So, what does it mean by supracondylar fracture of humerus? The fracture through the supracondylar region of the humerus is also known as supracondylar fracture of humerus. It is the commonest and most serious fracture in children. The incidence gradually increases with the increasing age of the children. It is rare after the age of the 11 years and the peak age is 7.5 years. Now this is a picture showing supracondylar fracture and this is X-ray showing supracondylar fracture. Now types. It may be extension type or flexion type, out of which extension type is common. This is flexion type and this is extension type. Now causes. The lower end of the humerus is weak due to its anatomical peculiarity. Because of the thin flat lower end and presence of the olecranon posteriorly and coracoid fossa anteriorly. Because of the frequent fall on the elbow, like fall in outstretched hand, slightly flexed elbow during playing, fall from a height, and road traffic accident. The mechanisms of supracondylar fracture of humerus. Supracondylar fracture of the humerus is caused by frequent fall on the elbow, like fall in outstretched hand, slightly flexed elbow during playing, fall from a height, and road traffic accident. Now clinical features. The patient profile is between the age of the 5 to 10 years children and symptoms includes history of the falls on the elbow, fall in the semi-flexed elbow on outstretched hand, pain and swelling around the elbow joint, deformities at the back of the elbow and restricted movement of the elbow. Now signs include swelling around elbow joint, very much tender, sometimes child does not allow touching, elbow in the flexion position within 30 to 35 degree, crepitus may be felt, and movement of the elbow very much painful and restricted, and examination of the radar pulse for injury to the brachial injury artery, and examination of the hand for evidence of nerve injury can be done. Now investigation. X-ray of the elbow joint including lower end of the humerus, anterior, posterior and lateral views. And the treatment includes, in case of the undistressed fracture, immobilization by the long arm back slap for 3 weeks. In case of distressed fracture, reduction by traction and counter traction under general anesthesia, followed by the long arm back slap, mid-arm to knuckle with the elbow lesser than 90 degree for 3 weeks. Now, complications of supracondylar fracture. The immediate complications include occlusion of the brachial artery, Bachmann's ischemia, gangrene, radial nerve injury, median nerve injury, and late complications include Bachmann's ischemic contracture, Malunion, which leads to projection of the distal end of the proximal fragment causing restricted movement, cubitus varus, cubitus valgus, and internal rotation, non-union myositis ossificans, stiffness of elbow, and tardy nerve palsy. End of the topic.